learning 10 different ways to regulate your vagus nerve might miss the most important points and actually keep you from real regulation. Here's what rarely anybody will tell you. The more you consume self-regulation advice, the more you start to believe that it's all on you, that if you are dysregulated, it is your fault. You just have not optimized yourself enough, right? But the catch is this type of thinking does not reduce stress. It adds to stress. Of course, we're all responsible for what we do with the body and the mind. But when we're told the solution is to fix ourselves better by ourselves, then that conveniently ignores the issue that many of us are trapped in systems that create overload. Maybe look back at your own experience when there is a family gathering, a function. Who is doing the work? Who is organizing, preparing, managing? Who knows everyone who is supposed to attend and from where they arrive and at what time they will arrive, and then when the event takes place, keep everybody happy and read the room and arrange here and there constantly. Who is doing all that? And who comes in, tells a joke, sits down and just relaxes? Who gets to relax without feeling ashamed, without feeling they don't do enough, they don't contribute enough? And equally, who gets automatic assistance? If you have learned to accept this as normal, then you might also feel as if you are failing if you cannot fix your nervous system alone, right? And that is a fast track to midlife burnout, because chronic overcompensation or not being allowed to express dissatisfaction with being made to overcompensate, that can absolutely lead to burnout after a few decades. Self-help can be a trap. In case your preset is, if I can handle it alone, then I will handle it alone, or I should handle it alone, then you are caught in that trap. Would you tell your friend, when they just broke a leg, just don't move your leg for 6 weeks, I guess it will be fine then? No, you would get them help, a cast and crutches and pain relief and support. So why do we treat our own nervous system differently? Just because you know how to make it more bearable for a minute, that does not equal that you don't deserve assistance. Just because you can carry a heavy load alone does not mean you should. People who are always expected to function often don't expect help, or they also, for that reason, do not seek help from anyone anymore. So naturally, they will turn to self-help, self-regulation. And then they become very good at this. And the next thing that happens is that self-regulation and resilience and so on get automatically assigned to them. And then they turn from an expertise into a responsibility and into an excuse for receiving less care. Understand the mechanics of how that happens. To break through this mechanic, just remember 2 simple things. 1, self-discipline is best in combination with self-compassion. That goes especially if you carry a lot of responsibility. And secondly, support is not a last resort or a luxury, especially when it comes to the nervous system. Your nervous system is literally the most precious fabric on this planet. Even a heart can be replaced. Your nerves cannot. Please never feel any shame or hesitation for getting help or assistance or accommodation for your nervous system. If it is difficult for you to admit or to ask or to receive, then that is normal. You probably have not learned that it is okay to do that, right? But I request that you look at such internal and external messages that you have to push through, stuff like that. More and more non-binary people and women are thankfully now talking about these things and learning to prioritize their health and their sanity also. I wish you all the assistance you might want and 0 second thoughts about it.